us in welcoming Dean and Distinguished University Professor of Epidemiology at the Dornsife School of Public Health at Drexel University, Diez Roux.
What do you think about when you hear the word environment? If you're like most people, probably the first thing that comes to mind is the natural environment. For example, the forests, the lakes, the mountain ranges. Perhaps you also think about environmental hazards like lead in the water or air pollution from traffic, power plants, or industrial activity. If you're an urban planner, maybe you think about the built environment of cities, how the streets are laid out, and whether residential and commercial uses are together or separated from each other. You may even think about things like the food environment. Can you get fresh fruits and vegetables in your neighborhood? Or the physical activity environment. Are your streets walkable? Are there pleasant public spaces? Or even whether your neighborhood gives you a sense of comfort and safety, or makes you feel insecure or threatened. All these things are the environment, and all these things affect our health in very direct and obvious ways, but also sometimes in ways that are much more subtle and indirect, but equally powerful. The impact of the environment on our health is pervasive, it's all over the place, and it's large. When we think about the links between the environment and our health, there are three things that it's critical for us to remember. The first is that although we often think of the built and the natural environments as separate, they are actually inextricably linked and influence each other. The natural environment influences the way in which we build our homes, our neighborhoods, and our cities. For example, let me give you an example. We often design our homes to protect us from inclement weather. In wealthy countries, we often set up sophisticated heating and cooling systems. Sometimes we spread out our homes and place multi-lane highways to connect them, allowing us to live very far from where we work, for example. And we encourage, and sometimes we even require, transportation in private vehicles to get from one place to another. These decisions have major impacts on energy use and greenhouse gas emissions. For example, multifamily homes in transit-oriented development, a type of development that encourages the use of public transportation, consume a lot less energy than single-family detached homes in conventional suburban development, which promotes car use. Energy use and emissions cause climate change, and changes to climate have major impacts on our homes and our cities and our health through increased frequency of heat waves or disasters like storms, floods, and fires. Consider the recent fires in California, not only the terrible toll in terms of lives and property damage, but also the enormous health impacts resulting from air pollution generated by these fires. Several cities in California became the most polluted cities in the world as a consequence of these fires. The health impact of these exposures is enormous, not only now, but also into the future, given what we know about how exposure to air pollution in childhood can affect lung development in ways that extend well into adulthood. Climate change also impacts health through many other processes, including changes to the transmission of infectious diseases, as well as its impacts on the displacement of populations, leading to social conflict and violence. Thus, the built environment we create affects our health directly by influencing, for example, how much physical activity we get or how exposed we are to air pollution, but it also impacts our natural environment. And the natural environment, in turn, directly impacts our health as well. A second major point to remember when we consider the links between environments and health is that there's no contradiction between promoting health and protecting the environment. In fact, policies that promote health are good for the natural environment, and policies that protect the natural environment are good for health. Sometimes this is referred to as the co-benefits of environmental and health policy. For example, we know that consuming less meats and less processed foods and more fruits and vegetables is good for health. It turns out that it's good for the natural environment too. Meat production is a major source of forest destruction and greenhouse gas emissions. And when we promote active transportation by walking or cycling, not only do we promote health, we also reduce the emission of pollutants. When we reduce urban sprawl to protect natural areas, we also promote physical activity. When we protect the diversity of life on our planet, we protect human health too. The diversity of plants, for example, has contributed to drugs that can make us healthy when we are sick. Exposure to natural environments has been shown to reduce stress and promote health and healing. And green spaces in cities reduce temperatures and buffer the adverse effects of heat. Thus, good environmental policy is good health policy, and good health policy is good environmental policy. A third thing to remember when we consider the links between environment and health, and perhaps the most important thing, is that we can do things to protect health and promote environmental sustainability. It is within our power to change the trajectory that we are on. It is still within our power. There are many challenges. There is inertia. There are forces and dynamics that make change very difficult. There is powerful opposition. But there are also examples emerging across the globe. We can build or retrofit cities and neighborhoods so they encourage walking and reduce reliance on cars, and so that they include more green spaces. We can reduce consumption of meat and processed foods. We can reduce energy consumption and greenhouse gas emissions through less driving, less air travel, less consumption of non-renewable products, and reducing our energy use to heat and cool buildings and homes. We can use more renewable energy and think about what kind of economic growth is really best for our future. We can use regulation to set standards. Regulation resulting from the Clean Air Act, for example, has saved many, many lives. Evidence-based regulation really works. And we can do these things in ways that promote fairness and equity, and health equity, as environmental factors, as the Bloomberg Fellows noted, are major drivers of differences in health by race, ethnicity, and social class, major sources of health inequities. So next time you see the word environment, think about all that it encompasses. Think about the built and natural environments as linked systems that influence each other. Think about the co-benefits of health and environmental policies. And think of environmental policy writ large as a major tool at our disposal to improve the health and protect the health of all of us. But don't only think, also act, because there really is no time. Change is urgent. Thank you.
Ladies and gentlemen,